Persistent knee pain slowly shrinks your world. It turns everyday routines into obstacles and strips away your independence. If your mobility is heavily restricted, you already know you need a knee replacement. Your actual decision is choosing the pathway to get it done. The research team at the Best of Health compiled the latest 2026 data across both public and private sectors to help you navigate this exact choice. A common misconception is that paying out of pocket secures a superior medical device. Both the NHS and private hospitals utilize the exact same NICE regulated implants. These side-by-side gauge charts displaying the clinical outcomes for both sectors. They are identical. In both pathways, 85 to 90% of patients report significant pain relief. Medical safety is equal. Your decision comes down to a strict trade-off between your budget, your pain tolerance, and your time. The primary advantage of the NHS pathway is obvious. Your procedure, your hospital stay, and your implant are fully covered. You pay £0 out of pocket. The trade-off for that free care is a severe delay in treatment. Right now, roughly 49,500 patients are in line for NHS knee replacement surgery. This timeline maps the current delay. In England, the average wait is 28.7 weeks, roughly 6.5 months. But geography matters. In Wales, the wait stretches to 22 months. In Northern Ireland, 64% wait over a year. A delayed surgery carries physical consequences. Over 6 to 12 months, a deteriorating joint often leads to a further decline in overall mobility and muscle strength. Choosing the NHS successfully preserves your financial capital, but it actively costs you at least half a year of comfortable movement. The private healthcare pathway offers rapid access to the operating room. You also gain the ability to choose your specific surgeon and recover in a private room. The timeline advantage is massive. Most private providers can schedule your surgery within 3 to 4 weeks of your initial consultation. That speed requires a significant financial commitment. The current cost ranges from £10,000 to £17,000. Looking at this comparison matrix, the stark reality is clear. The NHS is free, but takes 28.7 weeks. Private care averages £15,138, but treats you in 3 to 4 weeks. Private facilities also offer access to newer technologies, like robotic-assisted procedures. A private surgery fee is a purchase of time. You are explicitly buying back 6 months of an active life. That £15,138 average is not a universal fixed rate. The Best of Health's research shows that prices fluctuate wildly based on location and hospital group. This horizontal bar chart ranks UK regions by starting price. Southeast England is the most affordable, dropping as low as £10,226. At the other end, the most expensive procedures are found in Wales, reaching nearly £19,000. The corporate provider you choose also drives the final fixed fee. Groups like Circle Health, Nuffield, and Spire all maintain distinct pricing brackets. For patients willing to travel outside their immediate postcode, shopping geographically is a highly effective strategy to reduce the financial burden by thousands of pounds. Liquidating £15,000 upfront is a heavy barrier for many middle-income households. To counter this, all major private hospital groups now offer 0% interest payment plans spread over 10 to 12 months. This financial breakdown table takes that average private cost of £15,138 and divides it evenly across a single year. The trade-off is clear. It requires a credit check and commits you to a fixed monthly overhead of roughly £1,260. Financing shifts the private surgery dilemma. It turns a massive upfront wealth drain into a manageable monthly cash flow calculation. Once the logistical and financial choices are made, the post-operative reality takes over. This phase is identical, regardless of your pathway. In the immediate recovery phase, you will be walking with assistance within the first 3 weeks. Full recovery takes between 6 and 12 months. Hitting that milestone requires intense, non-negotiable physiotherapy. The long-term outlook is excellent. Data shows that 96% of modern implants survive at least 10 years, and for most people over 50, a knee replacement lasts the rest of their life. Money buys speed to the surgeon. It cannot buy a faster physiological recovery. Personal effort in rehab is the ultimate equalizer. This quadrant chart maps your ideal pathway. The vertical axis is pain severity. The horizontal is budget flexibility. For manageable pain on a tight budget, the NHS is correct. For severe daily pain with cash flow, private care is a justified investment. To compare specific local providers, check exact regional prices, and review surgeon success rates, visit thebestofhealth.co.uk. Armed with this data, navigating a knee replacement is no longer an overwhelming unknown. It is an empowering, solvable equation.